Hi everyone, welcome to our very first episode of Hola Meds. I'm your host, Janelle. Today, we'll be talking all about OTC medication. Joining us is our COO and resident pharmacist, Joelle Reed. Hi Joelle.
Hi Janelle.
Thank you for joining us today. How are you?
I'm doing good, thanks. How are you?
I'm doing well, thank you for asking. Let's start with the basics, Joelle. What's OTC medication?
Alright, so OTC medications are over-the-counter drugs. These can be accessed without a prescription by the patients. These are categorized as List 1 drugs and List 2 drugs.
Okay, that's interesting. So for our viewers who may not know what's List 1 and what's List 2.
So List 1 products are products that can be found in the pharmacies, supermarkets, gas stations, and these products can be accessed without a prescription or without consultation with a pharmacist. For example, our new gel suspension, which is an antacid, and it is used for heartburns and gastric acid reflux. List 2 products, on the other hand, though, these products are found behind the counter. So in order for patients to access these products, they'll have to consult with a pharmacist. For example of these are some multivitamins such as our Amino Pep, products used to treat dry eyes, and an example of this would be our Sister eye drops. And there are antibiotic ointments that has to be accessed through speaking or consultation with a pharmacist, such as our Nebonol ointments.
Okay, that's really interesting. So why is it that we can readily get List 1 products over the counter, but we have to consult with a pharmacist if we would like a List 2 product?
All right, so the List 2 products are a little bit more complicated, and these products have some restrictions because they cannot be used in all conditions, or not everyone can use them based on their current condition. So for example, a patient that has some comorbidities such as heart disease, diabetes, hypertension, they can't readily just access any cough and cold medications because it may have an active ingredient that either increases the heart rate, which in the end it increases the blood pressure rate, or they have sucrose in them, which is contraindicated in patients with diabetes. So it is important for patients like those to, consult with a pharmacist before taking certain medication.
Okay, Joelle, that was some really good information. So I just had a thought. Is there any other reason why a pharmacist would need to intervene when it comes to OTC medication?
Absolutely. With over-the-counter medications, there are many reasons why pharmacists would need to intervene. One very common example would be now it's the flu season. I have many patients who are experiencing cough and cold symptoms. A patient may be having some headaches and would go ahead and take 2 paracetamol, but at the same time, shortly after, the dose for them to take a dose of multi-symptom to treat their condition, which this multi-symptom may contain paracetamol. Basically, what you find happening is that there's an overdose of paracetamol in the patient, which can lead to liver disease, and patients may not know this or understand this, and it's important that the pharmacist does the counseling and let the patient know that if it is that they're taking multi-symptoms which contains paracetamol, that they should not take another drug with paracetamol to prevent the overdose.
Oh, that's really interesting. I actually did not know that at all.
Well, say thank you.
Thank you. We always learn something new.
Right.
All right. So thank you so much for joining us.
You're welcome.
And we hope to see you soon again.
No problem.
All right, we hold you to it. Okay, so there you have it. All you need to know about OTC medication. Stay tuned, and until next time, go on Hola Meds.